Hi everybody, this is Dr. Lewis of Coastal Wellness in Lisbon. Today we're going to talk a little bit about scoliosis. There was a question that was submitted somewhere along the lines of what can chiropractic do to help with scoliosis. So first I want to explain what scoliosis is, what the result of it can be physically in our body, and then what we can do to help it. So first and foremost, the scoliosis is when we're looking at the spine from the front, it is an abnormal deviation away from the center line. So normally we should have a nice straight spine like that. Obviously, every deviation from normal is not necessarily a huge problem, but when we see a major scoliotic curve, okay, this obviously changes the biomechanics in the spine, the way we move. So the spine has different ranges of motion, different freedoms of movement. All the joints in the spine articulate with each other and make up the way we move. So if we have a deviation from normal, this can lead to abnormal biomechanical stress in certain areas of the body, lead to more restrictions in certain areas of the body, more pain and sensitivity in certain areas of the body. When we're doing just day-to-day life, okay? So obviously the degree of scoliosis matters. The more of a curvature, the more associations we have with more pain, dysfunction, changes in mobility, the possibility of sort of nerve compression that can lead to peripheral symptoms, etc. So the first thing we want to understand is that the scoliosis is an abnormal movement, creates abnormal movement patterns. And chiropractic, the way we help with people with scoliosis, is not necessarily to correct scoliosis, not always the goal with this, although you can see improvements in scoliosis when you start to create better mobility to the spine. But the goal isn't always to correct the scoliosis, but to manage symptoms and to manage the compensations that might be happening and help the body adapt better to day-to-day life. So obviously when we're adjusting people with scoliosis, the goal might not be to see them every single week, but the goal might be to find a frequency that's ideal for them. Also talking about exercises and other lifestyle changes that can help improve their adaptability. Not everybody that has a major scoliotic curve deals with a lot of pain dysfunction. It just gives you susceptibility to that. And then other lifestyle factors can influence whether or not you feel pain or dysfunction or lead to early onset degeneration or anything like this. So the goal of chiropractic care with anybody with scoliosis is to help them adapt better, help them deal with any areas of restriction or pain they might be experiencing, and find a frequency that's ideal for them to sort of maintain things in a better position than otherwise. So yeah, if you haven't had an evaluation, please do book one, and let's get started. All the best, everybody.